Good morning, everybody. My name is Don Woodeley Victor. I am in third year of industrial engineering at Quisqueya University. It's a pleasure for me to present my presentation on the evolution of COVID-19 in Haiti and the different solutions to take to prevent its rapid spread. Here is the summary of my presentation. My presentation has 3 parts. We have an introduction, a development, and a conclusion. Subject: new COVID-19 case in Haiti. What solutions to reduce its propagation speed? In the introduction, we are going to define COVID-19 problem. Apparently, news is spread over new cases of coronavirus in Haiti. If the danger is real, what solutions can we bring to prevent it from spreading more quickly, or to find the best against the coronavirus in Haiti? Objective of the presentation. At the end of the presentation, the participants will be aware of the evolution of the COVID-19 in Haiti, the different little innovative measures taken in order to prevent COVID-19 propagating more quickly. In the development, we are going to see together the origin of COVID-19, its symptoms and effects, country behavior facing this virus, positioning of Haiti compared to COVID-19, current situation, Haitian behavior, government reactions to COVID-19. Here are some propositions. Firstly, barriers, measures, use of vaccinations, public transport funding, build new habitats to dislodge people living in the slums, 80% closure of all our ports. Conclusions: we are going to recall of the subject and on the different measures to be taken to prevent the rapid spread of the disease in the country. At the end of the presentation, we will find the various documents consulted, bibliography. In this presentation, we present on the one hand the definition of COVID-19, its origin, its symptoms, and its effects, country behavior facing this virus, positioning of Haiti compared to COVID-19, and on the other hand, the virus, proposals, and measures to be taken to prevent the rapid spread of the disease in the country. Appeared in November in the Chinese province of Hubei, COVID-19 is the last born of the coronavirus family. It is a very contagious virus. In a few months, he contaminated millions of people around the world and caused the death of several thousands of them. It presents the following symptoms: fever, dry cough, fatigue, headache, loss of smell or taste, sore throat, etc. States and countries are organized to limit its spread. Right now, what is the positioning of Haiti compared to COVID-19? Haiti, by its geographical position with land, sea, and air borders that open to other countries, has not been spared. Haiti is very struck currently by COVID-19. Hospitals, centers like the Saint Luc Hospital in Port-au-Prince, the Haitian capital, that says it doesn't accept any case of patients. According to the latest report published by the MSPP, Ministry of Health in Haiti, it must be said that for several months, barrier gestures have been forgotten. Public transport were filled. Haitians didn't see the usefulness of being vaccinated. It was the arrival of British and Brazilian variants that would have triggered this case explosion in Haiti. Let's see the different solutions to take to avoid the rapid spread of COVID-19 in Haiti. Firstly, we should respect the hygienic barrier gestures that we use as armor, such as hand washing, social distancing, and wearing masks in public areas. Secondly, strengthen the Haitian health system by structuring and equipping hospitals and training health executives. Put forward an awareness campaign and a re-education process on how to develop mutual protection. 80% closure of all our ports, time to observe the evolution of the disease. Thanks to this measure, we are able to reduce the quantity of foreigners in the country. Public transportation funding to reduce the number of passengers. Build new habitats to dislodge people living in the slums. Avoid various public events, any activity that attracts a large number of people. Temperature of travelers arriving in Haiti by any means of transportation. Vaccination of the whole population. Companies must have their workforce. To conclude, ultimately, we are aware of the presence of COVID-19 in Haiti, which is of Chinese origin. It is a very dangerous disease because of its easy contamination. The danger is real, so the barriers measures are betting, and the reduction of people in services transport by this at the end by this are so many solid measures to adopt to prevent the rapid spread of the disease in the country. I think that's all.